Now for the news. Virgin Islands residents have been assured of access to high-quality healthcare following a major contract signing by the Social Security Board and the JIPA network on Thursday, October 1st. Minister for Health and Social Development, Honorable Ronnie Skelton, says the agreement with JIPA is another significant milestone as the territory moves to implement the National Health Insurance Program and the further advancement of healthcare in the Virgin Islands.
Let the signing of this agreement today with the JIPA network of healthcare providers serve as reassurance to the residents of the territory that the government of the Virgin Islands, through the Ministry of Health and Social Development, is doing and will continue to do everything within its powers to make sure that all our people have equal access to quality health care regardless of their pre-existing conditions, age, gender, employment status, and from birth to death. Our National Health Insurance Program partnership with the JIPA network will provide access to thousands of preferred healthcare providers, including those members in the Virgin Islands. And looking at the list, I see Eureka, Bougainvillea Clinic, Dr. Penn Medical Services, and I know Mr. Frith will sign on. This network consists of world-class clinicians, hospital, diagnostic facilities, and treatment centers around the world. In addition to access to thousands of providers, the JIPA NHI Alliance will also facilitate the coordination of patients' health care to reduce healthcare costs and promote access, enhance quality, efficiency, safety, and patient satisfaction. Ladies and gentlemen, this is a validated day for the provision of health care for the people of these Virgin Islands, with a continued enhancement of our healthcare financing mechanism that is but one component of our national health strategy towards a healthier Virgin Islands.
Developed by physicians, JIPA is an association of healthcare providers across the Americas. Dr. Kester Ned is CEO of the JIPA network.
I'm a practicing neurologist. I'm on the faculty at the University of Miami and also staff physician at Jackson Memorial Hospital. I've been involved in the care of patients internationally for the last 20 years. I used to be the medical director of Jackson International, so I had the benefit of overseeing catastrophic care for patients coming from the region and around the world to the United States, particularly in South Florida, for healthcare. And this gave us the impetus for building the JIPA network. The JIPA network consists of an association of medical providers that span from Latin America, Central South America, the Caribbean, and the USA. We do have an arrangement with the Aetna network, who is what we call a wraparound network. They have well over 1 million providers that we work with. So in the areas where we don't have a provider, we utilize the Aetna network for services. The way JIPA works, JIPA is based on physician-to-physician interaction. We believe that healthcare is a relationship between a doctor and a patient. Not a relationship between an insurance company and a patient, a hospital and a patient is a relationship between a physician. It's a very private experience, it's a private relationship. And contrary to popular beliefs, the marketplace in healthcare, because of the economic drivers that we see around us, we have lost the essence of communication between doctors and patients. And what JIPA Network sought to do was to develop an environment where doctors and patients could communicate with each other in a way that's sensible. What that does, it provides an opportunity for patients to get care in a way that is reasonable, it's efficient, it's safe, and it's of high quality.
The contract signing coincides with the ongoing registration process for the Virgin Islands National Health Insurance Plan that is expected to take full effect on January 1st, 2016. Deputy Director of the Social Security Board, Roy Barry, says the contract confirms that BVI residents will have access to an international network of healthcare providers as part of the NHI plan.
The National Health Insurance team has underscored the importance of adding access to an overseas network for emergency and non-emergency treatment. It is an element that might be considered essential to safeguarding the health and welfare of all registered beneficiaries of the program. This specifically might be the case in times when the medical service is not available within the territory, or when a covered beneficiary is traveling abroad and needs emergency medical treatment. The NHI team has been in discussion with several entities that offer regional and international access to specialist physicians and facilities. From the onset, the team was in communication with facilities in the areas most frequented by those who seek healthcare services off island. Some of these range from our Caribbean neighbors in the USVI, Puerto Rico, Trinidad and Barbados, and as far afield as Panama and the US mainland. The continuum of access in the case of medical emergencies whilst beneficiaries travel abroad is also of concern for the NHI. As we have recited many times during our public presentations, the team continued to progress its initiatives to solidify an overseas network for the National Health Insurance System. Today, we are pleased to confirm that an overseas network is now in fact in place.
The JIPA network comprises a large network of hospitals, diagnostic and treatment centers, including ancillary healthcare providers, pharmacies, medical equipment and transportation companies throughout the Caribbean, Central and South America, and the United States.